Okay, so this is the case study of an oral cancer patient. The patient is just 40 years of age. You cannot see that in the picture. He looks quite old and rotten because he's just 40 years old and has been a heavy tobacco smoker for 25 years. The initial findings were this bulging you can see here in the lower portion. It was just a very tiny spot that appeared like, I don't know, an infection from the tooth or something. But he presented to the dentist with his findings, and the dentist sent him to the oral and maxillofacial surgery unit of the hospital because they were already suspecting that this might be cancer. It looked like a cyst at first, but this was already quite bad. So, and the site was also painless, unless he applied pressure. So, unless he was biting on it, it was completely painless. So, he didn't think too much of it, but. That was the initial finding of the ortho-ping tomogram, which is a panoramic dental X-ray. And what you can see here is just, in general, the teeth. And as always, as you already learned, we mark that on the right side. So you'll be looking at him like this. So that is the right side of his face here. You can see some fillings, some missing teeth. That tooth is chipped off with just the root here. But the major problem is here. That is, the tumor seems to be infiltrating the mandible. So you can see the bone that seems rather dense here is just hypodense in that area, so it appears black, which is the site of the tumor, and that's not a good sign. So they took a biopsy of it. This was just 11 days after the picture you saw before. So within 11 days, the tumor started to push out all the teeth you can see here. They took a biopsy from that side. You can see some sutures here to confirm the tumor often was cancer, and it turned out to be a squamous cell carcinoma. That is a special carcinoma of the lining of the mouth, which is very typical for smokers' carcinoma. The tumor was growing rapidly. You can see that in the side where they took the biopsy, the tumor is starting to turn necrotic. So there was pus, item, coming out of that wound all the time, and it smelled really horrible. And you can see that all the teeth are dying off because there has no connection to the bone or to any blood systems, any supply of nutrients. So it's basically all rotting away. And that was 3 weeks after the initial photo. And the next slide is a comparison again. You can see that was day 0, that was after 11 days, and that was after 22 days later than this. So it's quite a progress for such a tumor. And that is just in August, we were just partying. It was his birthday, and we were partying it. And the next month, he was diagnosed with oral cancer, and probably not going to live for much longer. And at the hospital, they did a full-body computer tomography. They do this to determine if there are any metastases, so if the cancer has already spread. And what you can see here is the mandible, the lower jaw, and it should actually be like a U or a V-shaped thing in general, but you can see there's something missing here. It's not white in there, and that's actually where the tumor has dissolved the mandible, the bone of the mandible. And it's quite hard to see. You can see the lymph nodes, which are very well differentiated on that side, but this one seems rather diffuse. That's also a metastasis of that cancer, or a metastasis of the squamous cell carcinoma. And what you can see on the sides, which appears a bit weird, is just his arms, the bones of his arms, because he was like this in the CT scanner, so you can see his arms. Then they took an angiography. They did that to determine a suitable blood vessel that could be used in the transplantation, because of course they had to take out the tumor, and if you wouldn't replace it with anything, that would look as if he had been shot in the face or something. So of course they had to replace it with something. So they were looking for an artery, but also doing a general angiography. What you can see here is his face from the front side. You can make out the teeth here that are being pushed out, and that is the right carotid artery, the main blood supply for brain and face and everything. And that is actually the femoral arteries. You can see here branching from the main aortic artery, so that's basically the branch that supplies the legs here. And you can even see the catheter there, like a little pigtail up there, and that's just the rectum and stuff. Subsection image is actually done by first taking one image of the site that is to be examined, then injecting the contrast agent, and take another image, and then subtract everything that is equal in the image, so you just see whatever moved or changed color, or that is the subtraction image here. I also have a video. Wie mache ich das jetzt? Mit dem komischen Apple-Zeug, weil eigentlich alle meinen einfach. So that's the angiography. It is taken with a C-shaped X-ray device. That is a device that takes continuous images. You can see his hands here. You can see how he moves his hands and every bone in his hands and the contrast agent coming in. That is iodine as a contrast agent, a very dense material. So now you can see the other side on the left. Yeah, you can still even make all the teeth on the tumor side here. And that is the pelvis. You can see the hip and stuff here. And that is just the leather that is filling with contrast agent, so which is very darkening as well. And yeah, that's the full pelvic view during the angiography. You can see how the catheter was inserted into the right femoral artery, just leading up there. So now what's moving there is just his intestine. So the surgical procedure was partial mandibulectomy, so that removed the lower jaw, as I said, and they, as I already said, have to replace it with something. So they were putting in a femoral, a fibular bone transplant. Sorry, that is just the back of the leg because you need the front of the leg for stability, so to be able to stand upright. But you just need the back to be able to move your foot. So if you remove that, you can still walk, but you'll just walk like this without being able to move your foot like this. So they took aside from that, and yeah, took a skin transplant as well to cover up. That was from the left side, and the neck dissection is removal of the lymph nodes in the area because they already saw there was cancer in there, and so it's also the site where it first spreads to. So they performed the neck dissection. That's this looks like a horrible accident, but it's actually you can see that was not my patient, by the way. I was not allowed into the OR, so I couldn't take any pictures of that. But you can see how the mandible was removed here, and the patient, just the front bit was removed. Then they inserted this metal bar and fixed on the replacement, the bone transplant. And they dissect the neck, as I said, for the lymph nodes. So extract the lymph nodes. So you basically take incisions here and then pull all the skin over his face. This looks very horrible, but in the end you won't have any scars in the face. So you can just let your beard grow over it, and it's a really nice cosmetic outcome. So that's why they do it like this, even though it looks horrible in the surgery. Intraoperative X-ray image, you can already see 4 pieces of the fibular bone here that are put in place with the metal bar screws. And post-operative thorax X-ray image. It's not all that interesting, but you can see here is a nasogastric feeding tube that is leading into the stomach because the patient cannot eat. And you can already make out the tracheotomy near the bronchus, where the bronchus is branching, because he had a cut within the airway to be able to breathe, because his face was swollen like a basketball, basically, so he wasn't able to eat or breathe or do anything. And yeah, so that's the transplant site. The skin transplant was taken from there, and the femoral, fibular bone transplant, which is not that easy as well, because the incision is about that big, and you have to spread the muscles apart to be able to get to the bone. And yeah, you can see it here. The patient wasn't able to open his mouth all that much. So the next picture is better. That's the oral cavity 2 weeks after the surgery. You can see that the transplant is growing in well because there's actually hair growing in it. They might seem a little gross, but in that case it was a very good sign because the transplant was working out. Yeah, oh, never mind that video. I just skipped that video. So enough to see, you can see how that nasogastric feeding tube was going all the way down into his stomach here. And here you can see the 4 individual pieces of bone that were sort of shaped into a sort of nice new chin. And that was the pre-operative photo. You can see the bulging on the outside here, just slightly. Post-operative, you can see the large swelling here. There's quite a lot of fluid collecting in here, of course. And yeah, you already had that basically. There was the skin rendering, just some fancy stuff you can do with basically any CT or MRI scan or whatever. Anything that you have in slices you can build up into a 3D image as well. It's called volume rendering. And 12 days after the surgery, the cosmetic outcome is really well. He has a really nice chin, well-defined chin. There's a suction tube in place to take care of all the secretions of the wound because he has no lymphatic system anymore, so they got to get it out some way. 3 weeks after the surgery, yeah, looking quite good. And then he was also prepared for the radiotherapy. You can see he had that mask that would hold him in place because if he moved during the radiation therapy, it would get the beam on his brain, he would die. So he had to hold him in place with that thing, which you can see is held onto the table like this. And yeah, that is the pre-radiotherapy CT scan. You can see a massive swelling there. You can see how it's really, really badly swollen. But that's normal after surgery and after removal of all lymph nodes. So I think it's really fascinating to see. Also, you can see here the hollow bone of the inside of the ear. It's pretty cool to see. We're not going through all the slides because that would be too much. But IRMT isodose plan just means what is noted on there: intensity modulated radiation therapy. So the right, we're looking on the other side now again. The right lymph node was affected very badly, and the front area, so that gets the most radiation, while they try to spare the brain, of course, and the spine and all that stuff. So that's what this stands for. Medical physicists calculated. And then they went for the radiation therapy. Okay, so that was within the radiation therapy. You can see that he's fixed onto the table there, unable to move, with just a spatula in his mouth that would keep the proper positioning of the jaws and stuff. And as the machine rotates around him, it adjusts to the calculation, to the positions that the medical physicist calculated to receive the precise dose in the area, in the target area. That's when the radiation starts. So you can see little flashes of radiation striking the camera, this spray radiation. They have a 4 mega electron volt beam here, X-ray beam. And it just takes about 20 seconds or so for every position, and it rotates around the patient again, shoots him again, and gets the radar for 10 minutes. And in the end, if I can forward here a bit. That's in the end. We can see I gave him my video camera and put it in his belt packet here. He had it here. You can see all the radiation striking in there. That's at his belt. So basically, that's what his gonads would receive. You can already see all that radiation. Like crazy. Yeah, relapse of the disease. So he just had a tumor surgery and was undergoing radiation therapy, but that fucking cancer came back, if I may say so. So you can here see signs of beginning of radiation dermatitis. That is just like a sunburn. It's damage to the skin from radiation. And here you can see a small bulge. Also unknown what it was. It could have been scar tissue, but it was confirmed as recurrent squamous cell carcinoma by histology. So he received a central venous catheter, which is just like a venous line, but it goes right into the front of the right atrium of the heart. It goes into the superior vena cava to be able to inject the chemotherapy right to the front of the heart. That sounds horrible, injecting chemotherapy into the heart, but it's actually good because if you wouldn't do that, you would all the tissue around it would turn necrotic. So it has to be diluted very quickly. So you do it in an area of high blood flow, and that is basically the atrium of the heart, right near the heart. So because otherwise it doesn't work. Radiation dermatitis. So 3 weeks after radiotherapy, you can see he has a sunburn basically, and you can see that the hair is just lying up here, and the rest of his beard has completely fallen out. That is because of, as I said, radiation therapy and combined chemotherapy. And as a result of that, all candidiasis developed, among other side effects of that. That is a fungus infection of the mouth, because his immune system was severely weakened. He had anemia, so he had a lack of blood in general. He had a so-called chemo brain, that is that he couldn't concentrate, that he was always tired. And they treated this with only antifungal medication, which turned out to be quite well. But and what's the overall outcome of that? Still unknown, because with this diagnosis of oral cancer, his chance of surviving the next 5 years is just about 50%. And so think about it next time you're taking a smoke break. Are there any questions within the audience?
Did any of the doctors, or did they tell your friend how long the cancer was already growing before they diagnosed it the first time?
It was really developed really quickly, as you saw. It was just within a few weeks, so probably there was a precancerous stage, which is called luteal plaque.
So he's a friend of yours, or was he a patient for work, or?
No, he's one of my best friends, so that's why I've got all of the story basically. So,
okay, I'm very sorry for that.
Maybe just one question. How comes that you were allowed into all the different departments of the hospital and being able to take pictures and stuff? Because
I think they call it social engineering, so I don't hack computers, I hack people.